the really big story on what's taken place in Uzbekistan. And what I'd like to do is first give you a bit of a context on why we're looking at this so closely. Because just a couple of months back, there were reports that adulterated drugs from an Indian company in Haryana went to Gambia, which resulted in the deaths of several children over there. And now again, cough syrups, killer syrups, some allege, from India have gone to Uzbekistan, again deaths. So where did it start? October 2022, Gambia blamed the India-made cough syrup for the death of 36 children. In December, and it's all happening now, Uzbekistan claims that 18 children died after consuming Indian cough syrups. In both cases, the syrups were found to contain the toxic diethylene glycol. Now, India's drug regulator has launched a probe into a Noida-based firm manufacturing the drugs which went to Uzbekistan. We did try and reach out to the company. We dropped a letter to them as well physically and invited them to come to the show. They did not. The health ministry says it is in touch with Uzbek authorities. Syrup samples taken from the Noida drugs making plant. That's happened. The drug maker insists that they are not at fault. Manufacturing, though, has been stopped till the test results come through. I think what we need to do as we get into this discussion is explain to our viewers what is DEG, diethylene glycol. It is a powerful industrial solvent. It's used in brake fluid. It's never used in the manufacture of medicine. It shouldn't be. It can be fatal if consumed by humans. It causes kidneys to fail. That can eventually lead to death. Children tend to suffer more in cases of DEG poisoning. This comes from the book, The Truth Pill. I'm very privileged to be joined first by Dinesh Thakur, a renowned global public health activist and somebody who has been tracking this very closely. So, Dinesh, this is the second case. And therefore, the basic question, it's obviously not the intention of any company to sell products which result in deaths. Why is this happening in India? What is the problem with DEG? Where does it originate?
Thank you, Vishnu. Let me first start by, offering my condolences to the parents of these 18 children that succumbed in Uzbekistan. I mean, no parent, deserves to be in a situation where you have to care for a sick child, much less someone who dies from taking the medicine that you give them. In one of the graphics that you showed, Gambia, you said 36. The actual number is 72 now. It's twice as many. Initially, it was 66, but the counting started increasing. Now, the question you're asking, why do these things happen? Well, these things happen because pharmaceutical companies that are supposed to follow what are called good manufacturing practices, they don't do that. And unfortunately, our regulation and our regulator doesn't hold them accountable. I mean, these incidents are garnering international attention because they're happening outside of India. As we describe in the prologue to our book, The Truth Pill, there have been 5 incidents in India, starting 72 all the way until 2019.
So let's bring up that graphic. Hold your thoughts for half a second. This is again data which we've got, which is important. Let's bring up that graphic if we can on the cases which have been registered, graphic number 5. Let's just have that up for our viewers. There have been at least 5 major drug poisoning incidents in India. This is what Dinesh was referring to. Let's go through the dates when this actually took place. 1972, in Madras, 15 children died consuming cough syrup. It had diethylene glycol, again DEG, let's refer to it as DEG. In 1986, Mumbai, 14 patients died after consuming adulterated glycerine that had been adulterated with DEG, diethylene glycol. 1988, Bihar, 11 patients killed because of DEG poisoning. 1998, Gurgaon, 33 children aged 2 months to 6 years killed. The cough syrup was found adulterated with DEG. 2019, Jammu, 9 children died because of adulterated cough syrup. This is all from Dinesh's book. He's been looking at this very closely. These are all based on reports which have actually come. So the point, Dinesh, that you've been repeatedly making is that this is not something that suddenly emerged. It's been happening for a long, long time. My question to you is this, is DEG in any in any way acceptable if it's in tiny, minuscule amounts, or is it completely banned across the world for medication?
Yeah. So, diethylene glycol essentially is a chemical solvent that is never, ever used in making medicine. The way it works is our kidneys are incapable of processing even trace amounts of diethylene glycol. The way it manifests, in people who take, even trace amounts of diethylene glycol is you develop what is called an acute kidney injury, meaning the kidneys refuse to function. Now, imagine how little children are, right? How much their bodies weigh. If you take a drug, proportional to the child's weight, the child's kidneys are not capable of processing even small amounts.
And there are international guidelines and laws of the WHO which ban DEG.
Of course.
So it's illegal.
There are.
You cannot have DEG.
It is illegal
in any country, right? In any.
Yes.
The reason I ask this question is because Uzbekistan says, before being hospitalized, these children took this syrup at home for 2 to 7 days in doses of 2.5 to 5 ml 3 to 4 times a day, which is much more than normal in any case. So I'm asking whether it was they were poisoned because they'd had too much of it. But what you are saying is no, you can't have DEG at all. Certainly not in children. Is that right?
Correct. So if you look at the release from Uzbekistan, they talk about the fact that it is the amount of paracetamol in that syrup that they were given in larger quantities. Now, the adverse event of paracetamol, acetaminophen, is liver injury. It's not kidney injury. And we saw the same kind of obfuscation, happen when the Gambian situation was reported, because, they had problems with clean water and they found bacteria E. coli. It was used to divert attention from the fact that children were dying out of acute kidney injury, which is symptomatic of diethylene glycol.
Right. And I think if we talk about the Gambia situation, the government of India did go to that company, Maiden in Haryana. They did do trials, and they said that no, in the samples that we've collected, DEG has not been found. So how do you balance that finding here with what Gambia and the WHO have been reporting?
Correct. And so I think it's important for us to understand, how, these things are actually done. The government of India and the Central Drug Standards Control Organization said that they have actually analyzed control samples and they have not found DEG. At the same time, both the World Health Organization and the Gambian authorities have repeatedly confirmed the presence of this poison in their syrup. In fact, prior to our conversation today, I sent you a copy of the report from Intertech, the Swiss lab.
I've got that I've got that over here, and I'm just going to show that to our viewers. We don't have it on a graphic, but I've got this. This is what the World Health Organization, this is where they went to this facility in Switzerland, and they tested the samples of Indian drugs from Gambia over here. And what the point being made is that on page 3 of this report, ethylene glycol and diethylene glycol, right? It's all been identified over here as having as being present, right? So ethylene glycol in this particular sample of a cough syrup from Gambia is found 2.2%, diethylene glycol 19.7%, right? Then in another sample 1.7%, 2.1%, so and it goes on. One of the drugs has 10.7% diethylene glycol in the sample, right? So therefore the point that you're making is that it's one thing for the government of India to say that, look, we've done our tests and we found nothing, and I'm sure that's correct. But the bottom line is how the children died, right? And that is on the basis of the drugs which were supplied to Gambia. That's been tested in an independent facility, and they say, the WHO, that look, this is the result.
Yeah. That's right. And based on that, the WHO had issued a medicines product alert, which essentially was a genesis of this entire thing back in October, right? Here's the issue, Vishnu, which I think that we should be very careful about, right? I think that we can have an opinion about these things, right? But we are disputing data here. And this is a very slippery slope that we have, we're going down right now. The point here is that in the CDSCO's report to the WHO, it says that it asked for a copy of the report and they never got that. They asked for a copy of samples. Now, I could get a copy of this report from Indotech. How is it that mighty government of India couldn't get a copy of this report and the samples that were actually procured from the site where the children died, right? I think that, we have to be very careful which way we're going down.
Do you believe that there is this sense of nationalism, India, pharma capital of the world, we can do no wrong, that is jeopardizing calm, controlled, scientific thinking and analysis? Is that the underlying...
I don't know what else to say, because you see, we can have our opinions about, how our industry functions, how our regulation functions. There's nothing taken away from the fact that we supply a vast majority of generic medicines to all over the world. But the moment that we start creating our own data sets and accusing, other countries of not doing their job, we are going down a slippery slope here.
One final point, and Dinesh, I'd invite you to stay on for the rest of this program as well, entirely up to you. These are from the Parliament of Gambia. This is a parliamentary report. It's about 45, 47 pages long. I've read it. Yep. And it's, it basically makes the point that in the conclusions, the Select Committee is convinced that Maiden Pharmaceuticals Limited is culpable and should be held accountable for exporting the contaminated medicines that was linked to the death of at least 70 children in the Gambia. So that number has gone up. It's now 70 that they're saying, not 35 as had been earlier stated by us. Right, the Select Committee concludes that cases of AKI is what? Acute kidney infection, is that right?
Kidney injury.
Are linked to the consumption of contaminated medical products imported by Atlantic Pharmaceuticals and manufactured by Maiden Pharmaceuticals India. The acute cause of death of these children is still under scientific investigations, as causality tests are currently being undertaken by the Ministry of Health and partners. What does that mean, the second statement? Because on the one hand, they're saying
So, see, it's important to understand how causality is established, right? You have to do autopsies. You cannot make statements just like that. Imagine this is an Islamic country that buries its children right away. You have to exhume bodies of those children, perform autopsies on them. You think that's easy to do in an Islamic country like that? They're being very honest about it. Look at that report. They have looked at every facet. They have looked at epidemiology. They have looked at pathology. They have looked, specifically around the drug importation. They acknowledge that the country doesn't have capacity to regulate drugs. They're being honest about it, and they're doing it in a transparent manner.
Right.
Why don't we do that?
Okay, Dinesh, let me bring in the rest of our panel. Chinu Srinivasan joins us. He's co-convener of the All India Drug Action Network. Dr. Gopal Dabade, member of the All India Drug Action Network. Karuna Gopal of the BJP, Shama Mohammed of the Congress. You've all been listening to this, and it's fairly shocking what is emerging on the basis of fact and data of lab tests besides anything else. Karuna Gopal, it's the second time this is happening. Let's not look at this from an image of where India's pharma capital right now. Let's look at it from the loss of life. What do you have to say about the loss of life of so many children in Uzbekistan?
Well, Mr. Som, it is not an ideal situation, but I would also like to highlight the fact that the deaths from Gambia have not been proved, or as we have been discussing with Mr. Dinesh, that the causality has to be established. Our DCGI, the Drugs Controller General of India, has Dr. Somani has written quite a few times to the World Health Organization asking for details, and the details have not been supplied. And today we are still waiting for them. I remember the letters have been sent in October 13th, October 20th, and 29th, and even as latest as in December. So when that is not clear, then you cannot squarely blame India. And the samples also, as has been discussed, have been given to our laboratories. And we have not seen those two toxic elements. What we found was only propylene glycol, which is acceptable. So when this is the case, there is no point directly blaming India. Let's not jump just the way the World Health Organization has jumped the gun. We have to give it a bit of time. Understand the entire context. For instance, we have been just pushing aside the fact that India is the pharmacy of the world, which is true. If we really look at what is happening in the pharma industry today, it is slated to be $1 trillion.
No, that's a separate point. And we are all terribly proud of it. But the point is that when that reputation gets dented as a result of things like this, we need to be assessing that. So I think there's national pride at one level, and it's brilliant what we do, for example, with vaccines.
Understand the numbers, Mr. Som.
But this is the loss of life.
No,
and so we need to reflect on
the numbers. We are looking at, I'm trying to give the numbers only so that we understand the magnitude of our contribution to the world. We export to 206 countries, and we are treating a large component of the humanity. And there are these incidents of 11 people dying in Uzbek, and we are squarely blaming India without even understanding whether we are actually establishing the causality or not. So that's
okay. And that's an important point. Let me get a reaction on that. Shama Mohammed, would you like to come in on this? That let's not jump the gun. There is the issue of causality in the Gambia, as Dinesh mentioned. It's difficult to establish, irrespective of what the reports show. Do you believe that even in the case of Uzbekistan, we need to wait, or do we need to just go by what their government says?
Vishnu, the WHO says there is diethylene glycol, right? When you have, just now as you had mentioned, tested in the Swiss labs, and they also said there is diethylene glycol.
Yes.
So when we are a huge pharmaceutical nation, you know that we are the biggest pharmaceutical nation, exporting 40%. We go 40% of drugs, generic drugs used in the US are from India. 25% of all drugs used in the UK are from India. But of course, what for me, the most important part here is when the WHO is saying right now, when we export so much of drugs, means we have to take it seriously. Let's be accountable for once. You know, after 2014, there's something called no accountability. Now, according to me, the CDSCO has to be held responsible. So it's similar to what the FDA is there. We have the drug regulator. Now, we have to understand what Mr. Thakur also knows very well is that our drug regulators in each state, they are very poorly equipped, right? The labs are very poorly equipped, underfunded, and very less staff there. So they definitely cannot carry on these sort of tests. Now, who's supposed to overhaul it? The CDSCO. What is it doing? Mr. Somani comes out and says, you know what, we tested it. There is nothing in it. There is nothing wrong. Now, that's a wrong thing. If there is something wrong, look into it seriously. And also this Marian Biotech, which recently, the drugs which were sold to Uzbekistan, only exports. Indians don't use that. It's only for export. Now, what we need to, for me, the most important thing is CDSO has to look at seriously, because children, if it was my child or if it is your child, Vishnu, how would you feel? So this is not done. And India, being a strong pharmaceutical company, a pharmaceutical producer nation, should get into it deeply and say, listen,
all right, Shama, I know Karuna wants to reply. I'll give her that opportunity.
Do that and do the...
Sure. Shama, 1 second.
We look into it. That's what we need to do. We need to stand up and take
Karuna, I know you want to reply. I'll give you that chance in a moment, but I wanted to first go across to Dr. Gopal Dabade, because here's another important issue. Who tests drugs for the presence of poison or things like that, or DEG? Is it the country that receives the drugs, or is it our responsibility? Legally, what is the position?
Thank you very much for this invitation. The country which exports the drug is equally responsible for whatever we export. It just cannot say that we export the drug and whatever we want, and then that country is ultimately responsible, because it is this nation's product that is going to be represented there. And we have to be aware of this, that as our previous speakers, as Dinesh Thakur said, that we are supplying drugs to so many countries in the world, and we need to maintain the good quality of these drugs. So at least for that sake, we should ensure that quality control is done and before these drugs are exported. So that is the bottom line, that quality control should be there for every drug that comes out of the Indian drug industry.
Chinu Srinivasan, is that a problem? That's not being done when it comes to the export of drugs? The onus on quality is exclusively on the companies, and oversight from the government of India, even if it does exist, is not at the standard that it needs to be?
Well, I think yes, the ball is in the court of the exporter, which is very clear. Occasionally, if as a drug controller...
Sorry to interrupt, but it's clear on what basis? It's clear on the basis of our laws, WHO laws, or whose laws?
It's clear on the basis of every batch I make as a manufacturer. I am responsible because I am supposed to test it in my laboratory, in my factory, and then make it available for any supervisory authority. So it is certainly, and I'm almost very sure that the importer will ask for the quality certificate. And you have to show the quality certificate, what you have done, how you have done it, and how your drug has passed. That is number one. Number two, in this case, to making a safe drug is not such an impossible thing. We are making a lot of muchness about it, because here, instead of diethylene glycol, we need to use pharma grade propylene glycol. And that is number one essential thing. The second thing is, if you use pharma grade propylene glycol or any other item which you use in a syrup or any medicine, you have to test every item. And in this case, apparently they have not tested. If at all they have used pharma grade propylene glycol, if they have not tested, if they have tested it, they should have found out the contaminant diethylene glycol. Apparently they have not done it, because I cannot see any other reason when a perfectly safe drug which goes from here suddenly gets diethylene glycol in Uzbekistan. It's almost impossible.
Okay.
So I think yes, you have to put some question.
Oversight is missing, is what you're saying, at all levels. At the level of companies and at the level...
See, oversight is of every batch on every pharmaceutical company, and everything which is exported and made in this country is not possible for anybody. But they can do it randomly and occasionally when I suspect that something is wrong or some manufacturer is probably, because most drug controllers in this country know who is doing the wrong thing and who is doing the right thing in this country. Okay. So I think they can do it, but randomly they can do it. They cannot test each and every item. So we have to rely
obviously, it has to be a sample. The volume is too large. Karuna Gopal.
Pardon?
I take that point. I understand what you're saying. Karuna Gopal, you had a point to make. Go ahead, ma'am.
Well, I just wanted to let everyone also understand and take the larger context into picture. We understand that we are looking at the oversight, we are looking at the quality control, etc. But understand what is happening in the world and to the disease burden and the disease profile. I mean, historically, the world, we thought, moved away from infectious diseases to NCDs, non-communicable diseases like diabetes, cancer, and cardiovascular disease. But today, COVID resurfaced. So the world is experiencing different types of diseases on an entire huge spectrum, right from infectious diseases to NCDs. So obviously, the ecosystem, the pharma ecosystem is also going through enormous amount of changes. Look at what's happening in India. We have moved. We thought we were playing a volume game, but today we are playing a value game. I mean, look at the gestation time to produce a vaccine, and we shortened it so much that in the shortest of time we came out with vaccine.
No, but again, Karuna, why does this need to be seen through the prism of national pride?
It is not.
We are talking about a very sad situation, and whether the allegations are founded or unfounded.
No, I understand, Mr. Soma. I'm not denying it.
We are proud in any case of what pharma does. We need to go beyond that. We need to make sure that what is good remains, right? That's why we want to. So when you say, Karuna, that
the regulatory regime,
this is what we do and this is the volume, of course, 100%. But shouldn't we look at where it might be going wrong? I'm just saying we have to now look at the regulatory regime, which we are looking with a lot of interest. Today, we have a very vibrant ecosystem in terms of how governments are working with the private sector. And today we are looking at the intellectual property, how we have to look at technology commercialization. We're looking at many things at the same time because of the
the spectrum of diseases that we have and the kind of APIs that we have to work with. Today, India, when we discussed China, we said we are importing APIs from China. But today, India is trying to make its own APIs. So there's a whole bunch of things that are happening here, and the regulatory regime is going to be looked at very seriously by the government. And today, you see the response time. The minute we heard that Uzbek had these problems, immediately the health minister talked about random checks everywhere. And this has to happen.
Okay,
and
so the speed of response, you believe,
every batch cannot be tested.
Sure.
Every batch cannot be tested.
I know, Dinesh, you had a point to make, but make that point. But my question to you is this: why do we need cough syrups for children at all? Because from everything I've read, they don't work.
Yeah. So I mean, that's a larger, question for physicians. I think I'm not a doctor. I think somebody like Amrish Satvik, who posted a thread on Twitter on this, he can respond a lot more effectively. The only point that I will make, Vishnu, is as follows. We're paying so much attention to Gambia and to Uzbekistan right now. What about those 12 children that died in Jammu in 2019, December of 2019 and January of 2020? It's been 3 years now. Where is the prosecution? And by the way, the causality of this cough syrup to the company Digital Vision was established by PGI Chandigarh. Now, PGI Chandigarh is a very reputable hospital. Pediatricians there established the causality of 12 children born to people who live below the poverty line of a cough syrup made by a company called Digital Vision. Where is the oversight? It's been 3 years now.
Yeah.
Can I come in?
Yes. Yes, go ahead. Karuna, you want to reply to that, or?
Vishnu, what I want to ask her...
Sorry, Shama, go ahead, and then Karuna, yes.
Yeah, what exactly is that when there are these labs around the world, very regulated labs, let's understand that, are saying that there is diethylene glycol, I don't understand why is our CDSCO in charge, director saying that there is no, VG Somani clearly says there is no. So what we need to do, I mean, I don't want to say they are BJP ruled states or whatever, because we know that one Median Biotech, Maiden Pharmaceuticals and Marian Biotech. So one is in Noida, the other one is in Sonipat, Haryana. But, why don't we have local lab testings improved? That is what we need to do. Why doesn't she say? She says there's a larger thing. We are doing this. We are doing that. Why don't you hold Mr. Somani accountable? Why don't you hold the CDSCO, which is the regulator? Go and learn from the FDA, Food and Drug Administration of the United States. I mean, our regulation, let's understand that is very poor. Let's improve on that and work on that and hold him accountable or hold the organization accountable. But nothing comes up. It is only about the larger picture. Yeah, we contacted them. They contacted us.
No, but Karuna, as you answer that, I again just want to show this document.
No, Mr. Sona, I think we can do without this kind of sarcasm, and nobody need learn anything from United States. I'm happy you did not say that India has to learn from China. Look, India has, as I mentioned, you have to get the big picture, you have to understand the larger ecosystem. We have the largest number of CMOs and CROs.
No, but Karuna, my only point is this. On the Shama, one second.
Kind of disdainful
Shama, Karuna, let's not get into a usual this thing. We're talking about lives and we're talking about science. So let's just stick to that. 1 second, Karuna. The point I brought up earlier on is that this is a WHO, and Dinesh, correct me if I'm wrong. This is a WHO test which was done at a lab called Intertech. It is entirely independent. Yes. It's not China, Pakistan, India, this company, that company, BJP state, not BJP state. And this has established the presence of DEG in cough samples from the Gambia, right? Apparently Indian cough samples. Now, when the government of India says that the WHO is not giving information that they seek, how is it then that I'm holding this piece of paper and they presumably don't have it?
Lie. That's how they do it all the time.
Karuna?
Mr. Som, there is something called official communication. There's a line that the governments follow. The DCGI has written to WHO, and you think our country will jump the gun and say that World Health Organization is, jumping the gun? I don't think so. The reason is that they have not supplied the details and they have not done it through the official channel.
Well,
and therefore, today, we don't have that with us.
And to be fair, I did ask for a WHO rep on this program tonight. They chose not to be present today. But just one final question.
So there's one question. There's one question. Can I ask Mr. Dinesh about this?
Go ahead.
The entire discussion about the toxicity has been kind of restricted to the cough syrups. Like even in India, like we have talked about what happened in Kashmir, what happened in South India. So is it a good idea to actually look at investigating this whole thing about cough syrups, because it's not seemed to be in any other drug, like the zillions of drugs we produce.
Yeah, that's a very valid question. Why is this restricted only apparently to cough syrups? Other drugs use sweeteners as well, don't they?
Yes, and Ms. Gopal, you asked a very valid question, and I think that that's a question that needs to be asked of the drug regulator, right? The taxpayers pay the drug regulator in order to ensure that the safety and efficacy of what we buy at the chemist shop is as intended. And, this is a question that I think that you should certainly ask Mr. Somani and the CDSCL and get an answer for us, because I've been trying very hard. I've written a book about it along with my co-author, asking these questions. All I do is get threatening letters. So maybe you will have better success when you ask Mr. Somani, why is it I cannot trust the quality of medicine that I buy when I go to my local chemist office?
All right, we'll leave it on that note, but perhaps come back later to the entire issue of cough syrups, because a lot of people say they don't work at all. And it's sad if that's the case, then children have had to die as a result of that. We leave this debate at this stage. I'd like to thank you all very much for joining us.